name is Cynthia Goulet. I'm a registered nurse, and I work in the operating room at Memorial Campus of UMass Memorial Health, and I started June 18th, 1973.
I've known Cindy for the past 3 years of me working for UMass. I'm actually the service line manager of urology, which she is a huge part of. And everyday interactions are just her in the cases, asking me for help, her giving me help also, because her years of knowledge have been very helpful. Cindy really does urology, so Cindy is a proficient and the expert at all of urology.
When I started back in 1973, UMass Memorial Health didn't exist. At that time, there were 7 hospitals in the area, and I went to Hahnemann Hospital School of Nursing, and right out of school, I applied to work at Hahnemann. And since then, I've been through 3 mergers with Hahnemann and Holding, then we merged with Memorial, and then we merged with UMass.
My name is Michael Wallen. I'm a urologist. I have worked with Cindy for about 32 years. Cindy was the best nurse I've ever worked with. She taught me some of my urology because she had a vast amount of experience before I ever began my career and during my career, and we've been working together ever since.
Things have changed over the years, so now I'll be doing a lot of cystoscopies or going after kidney stones. There wasn't any laparoscopic or robotic, so with all the new technology, there's a lot more technical part of the job as opposed to hands-on part.
Cindy and I have worked 45 years together. I came from Holden Hospital. She's always there, and she knows exactly what the doctors need to use, so it makes it a lot easier for the rest of us when we work with Cindy.
I've always been a nurse, and I've always worked in the operating room. Well, I think I like the personal care. You only have one patient at a time, and you can concentrate on what you want to do to make that experience for the patient better.
There's a few cases that we do that the patients are actually awake, and they appreciate Cindy's actual patience with them, comforting the patients during surgery, making sure that they feel okay. She informs them of what's going on.
I feel my role when I'm in the holding area is to help ease the patient's mind as to what's going to be happening in the coming minutes while they are preparing to get into the operating room. You want to make them feel as comfortable as they can that they're going to be taken care of and that everybody's on their side.
Cindy's greatest strengths and qualities are communication and her ability she's memorized everything that every person does in her service.
The people that I work with, the physicians, they're all very talented. Keeps me busy and keeps me learning every day because I learn something new. Even though I've been there for 50 years, you still can learn something new from younger docs that are coming along. In fact, I work with some of the urologists now that were residents when they were going through their residencies, and they'll tell you when they're working with me, she taught me everything I know.
Well, Cindy loves listening to music. As it turns out, whatever music she enjoys is the music that we listen to. So I'll always have a memory of being in the operating room with her, a lot of 60s music.
I guess some of my greatest memories are the camaraderie you get with the people you work with, that you can socialize them at work as well as out of work. Probably my greatest achievement is helping influence the younger generation as well as helping training the residents that are coming along.
Cindy's attributes, she has many. Most important is she's very intelligent, has a superb knowledge of urology, has a vast experience over many, many years, has had the luxury of working with many urologists over the years, knows all the equipment better than anybody, is able to help in the operating room as an active participant of the team, not just someone who just provides a service, but really is involved as an integral part of the care team.
I suppose if I could give any nurse that's coming along, a new nurse, advice about what they should do, I would say to learn as much as you can, and as you're learning that, decide which path you want to take. Put your whole heart in that so that you become the best at what you can be.
Well, she's always happy. She's always there to help out, brings joy to the job.
What I like most about working at UMass Memorial Health is because I enjoy my job. I enjoy teaching, I enjoy taking care of my patients, seeing that their outcomes are successful. At some point in the future, I will be retiring. I'm hoping to move down to Florida, closer to my daughter, because she lives down in Florida.
Cindy, I want to congratulate you on your 50 years. I might have you beat if I keep going myself. God bless.
Cindy, congratulations on your 50 years at UMass Memorial. We couldn't do it without you.